Hi, I'm Dr. Ramprassath, Director of Cardiothoracic Surgery from Velalar Hospital and Medical College and Research Institute, Madurai, Tamil Nadu. I've been involved in endoscopic cardiac surgery in India for last 5 years. Since 2019, we have been using this approach for valvular surgery for ASDs, and recently we have actually even ventured on doing it for internal mammary artery harvesting. So in endoscopic valvular surgery, we cut down the incision with ease and maximize the visibility for the surgeon and as well as for the surgical team, so that the precision of the surgery is increased for the entire team member, and the patient is benefited to the maximum with this kind of approach, where they can go back to work within a couple of weeks. Actually, they get discharged in 3 or 4 days, and then they don't feel the pain at all, because we don't spread the rib like how in a minimal invasive surgery they try to spread the ribs. It causes pain. In endoscopic surgery, we don't spread the rib. We just use camera to see the valve, replace the valve or repair the valve according to the condition, and then discharge the patient in 3 or 4 days, so that absolutely there is no pain experience in endoscopic cardiac surgery rather than a big surgical trauma or a big surgery. First and foremost thing, they don't see any scar, because with a nipple also we'll be able to do it, and hardly we have a 3 or 4 centimeter incisions, and there is no rib spreading, so there absolutely no pain. And the early recovery, after 2 days they jump out of the ICU and then they just walk. They behave like as if nothing has been done to them. And the quick recovery, no pain, and the early return to work is the key for the endoscopic cardiac surgery. So when I started endoscopic surgery 5 years back, I started with a 2-dimensional endoscope. And now there is a lot of 3-dimensional scopes available in the market, which gives a very clear depth of immersion for the surgeon as well as for the team, so that the precision of surgery is increased, and the timing of the conduct of surgery is also decreased because of the advent of the 3D endoscope. And there are a lot of instrumentation which has been happening for this endoscopic cardiac surgery to make the surgery easily reproducible by all the surgeons around the country.